Hello, and welcome to another episode of Cutting Edge Health. If we haven't met, I'm Dr. Orlando Landrum. I help patients understand what are their options for being able to deal with physical pain, mental pain, and how to be able to punch pain in the face and get back to leading the life they deserve. Today, we're talking about being able to treat PTSD and do it with a different and possibly a better way. Today, we're talking about stellate ganglion radiofrequency. But first, we need to kind of start with the aspect of what is PTSD. We've actually covered this in a previous video. So if you haven't had a chance to check that video, take a look at it. But we're going to cover some of the basics. So PTSD stands for post-traumatic stress disorder. It's an element where there's a trauma or event that takes place that we're going to talk about a little bit more in depth and detail that results in recurrent thoughts that are not effective to being able to lead one's life in a traditional way. It impacts you, it bothers you. The episode that actually caused the trauma is recurrent and thoughtful. The stellate ganglion treatment that we're going to talk about is different than a traditional stellate ganglion blockade or injection. Traditional injection is an injection at the site, and this is a little bit of a modified picture because this is not the stellate ganglion block, but more the pulse radio frequency. As you can see, there's a wire or cord that kind of leads off to the left-hand side, which is the area that we apply heat to in that general direction. When we talk about PTSD, there's a number of different things that kind of are involved with this. So the most common traumas for across the board for civilians as well as those who are in the military is 50% of them are because of sexual abuse. And then you can see there's 30% that are because of physical assault, and 23% are because of other different types of sexual abuse, and then 16% is because of an injury or an accident that took place. Sometimes it's from a sudden death of a loved one, a life-threatening illness of a child, or someone who you're close to being killed or seriously injured, and then sometimes from natural disasters. So those are the most common reasons for trauma that are ranked. And when we talk about the number one cause of potential issues with PTSD, the number one is actual sexual violence, which is very closely followed by that of interpersonal violence. So those things are pretty prominent. In terms of how frequently it occurs within the population, well, actually what we see is that it occurs about 6% overall for lifetime in the general population, and about 12%, give or take, within that aspect of veterans. And when we look at veterans as a whole, one of the things that we see is that it actually can be much greater than just the 12%, right? And so one of the things that we actually identify is that it's at least 11% and sometimes as much as 23%. And that's pretty darn impactful, because if we're saying nearly almost 1 out of 4 people who have served have a potential problem with this trauma that's present, that is huge, and we need to be able to impact that. So how does that end up resulting in terms of how impactful it can be? Pretty darn impactful. What we see is the following, is of that among veterans, suicide risk is pretty darn high, particularly in terms of the thought. The thought passes, at least in a lifetime, of almost nearly 50%. And those who actually make the attempt is greater than 10%, almost 15%, or a little bit more than 15%, in fact. So that's pretty prominent. And in terms of veterans who die by suicide each day, it's around 17 veterans that pass because of suicide. So we really got to find ways to be able to impact that. But it's not just veterans who have this issue, it's also first responders. And what we see is paramedics, rescue team, firefighter, and police all have a prevalence of having PTSD, in addition to the general populace. So what are some of the ways that we've intervened with that? Well, stellate ganglion blockade historically has been used for pain, but what we've seen is that its utilization for post-traumatic stress disorder, or PTSD, as stated before, has grown and grown astronomically. And one of the different individuals that has been involved with this is Sean Mulvaney, who's a doc who's actually been incredibly instrumental in bringing us along. And actually another doc we're going to talk about for veterans is Eugene Lipoff, that's been huge in impacting those things. So, as mentioned before, we kind of went through the utilization of stellate ganglion blockade, and just kind of a quick sort of summation of that is a needle that's placed in and around the area of the stellate ganglion. Historically, it was done using fluoroscopy In distant times, it was done blindly, but for most people, it's been done using X-ray or fluoroscopy. But more recently, probably in the last 7 to 5 years, it's been done using ultrasound. And ultrasound lets us be able to see the vessels that are present and know that we're not injuring tissues that we sometimes wouldn't see under X-ray. So that utilization of that traditional block has been utilized for not just an aspect of PTSD, but for a number of different pain conditions. But what we saw is that treating it with a different type of approach, as opposed to just giving local anesthetic, but instead doing something where we apply a special type of needle. This is a picture of that on the left-hand side using ultrasound, and then applying heat to that area. That's a picture on the right-hand side of the heat curves, as you can kind of see represented, can actually improve a whole host of conditions. Historically, it's been looked at predominantly for pain, and we can see a number of different articles that represent that. Things like CT-guided, stellate ganglion for upper limb, postherpetic neuralgia, which is also shingles, or different things like the utilization of pulse radiofrequency for brachial plexus injury, or stellate ganglion for complex regional pain syndrome. So we can see all of those different types of treatments. And then what we say is, could this be a utility, something that can be able to provide value when we talk about using it for the context of potentially pain, and or rather PTSD, pardon me. And so, as mentioned before, one of the main thought leaders in this has been Eugene Lipov, who actually looked at not only stellate ganglion block, but pulsed radiofrequency for post-traumatic stress disorder. And what is pulsed and what is thermal? We're going to talk about that in a little bit, but the basic synopsis is thermal is a temperature that's high enough to actually cause damage to the tissue, while pulsed actually provides heat, but that heat doesn't damage the tissue, but it helps kind of reset it. And the value to that is it doesn't just reset it like the local anesthetic that we do with a blockade, but rather it lasts so much longer. So this picture is a picture of kind of that aspect of the ultrasound that we'll view, and we're looking at carotid arteries, we're looking at the jugular vein, and we're trying to be able to figure out what's going to be a good path with the eventual resulting placement of that needle that can be present with the aspect of the component of the probe that allows for heat to be placed. And we can see this under ultrasound on the right-hand side picture where that needle is placed, and you can see that it's coming into the area appropriately. As mentioned before, what takes place is that needle is placed, and inside the needle is a probe that is actually able to be a heated element that then results in being able to reset what's happening with the area of the stellate ganglion that has been able to improve trauma. And so one of the papers that kind of looked at that was the following paper, where it looked at potential treatment option, and what we ended up finding was the following in conclusion, is that we knew that stellate ganglion blockade is able to provide value. But the fact of the matter is a number of different patients don't get long-standing relief, and that sometimes the symptom relief can be short. So instead, by using a therapy like this, we can be able to get sustainable relief that can provide value to patients, can be an option to be able to get back on the feet, help figure out a way to punch pain in the face, and get back to leading the life that you deserve. So quick synopsis on being able to understand the utilization of stellate ganglion radiofrequency versus just stellate ganglion blockade. It's an armamentarium that is robust and should be present in your doc's toolkit to be able to help you be able to beat PTSD. Thank you so much. And if you have questions, please leave them in the comments below. If you'd like for us to cover this more in depth in a different way, please also leave that. Thank you so much. And if you felt like this was of value, hit the subscribe button to learn about other innovative treatments and how to be able to help you function and lead the life you deserve.